At the Green Door annual gala, former Senator Tom Daschle said he thinks Treasury Secretary Tim Geithner is doing a terrific job, and he does not regret withdrawing his name as President Obama's Health and Human Services Secretary nominee. Daschle also said it is vital that the government offer universal health care to all individuals, not just those with mental illnesses. Green Door is a community program that prepares women and men with mental illnesses to work and live independently in the District of Columbia. During the vetting process for President Obama's cabinet, it was revealed that former Senator Tom Daschle owed almost $140,000 in back taxes and Tim Geithner owed almost $49,000. But Daschle had to withdraw his nomination while Geithner became Treasury Secretary.
Do you think it was fair that he was able to take his post and you weren't?
I think it's important that we give the cabinet an opportunity to work, and the vetting process is what it is. I'm not going to look back on that. I think he's doing a terrific job. I'm an admirer of Timothy Geithner's, and I think he'll prove to be a very strong leader for the Treasury in the months and years to come.
Do you look back and say, I should have just let it go and just keep going instead of, pulling your name out of the ring?
I really don't think that. First of all, I'm not one who really looks back very long. I think it's important to keep looking forward.
Daschle also commented on the economy, saying Congress has not given the first stimulus package enough time to work.
Would you support a second stimulus package?
Well, I think we have to look at the need when the need is more carefully considered. I don't think we've given the first stimulus package enough time to work yet, so I think it's premature to come to any conclusion about whether we need a second one.
Green Door, the group that sponsored the event, helps people with mental illness to, quote, lead better lives. Daschle says it's important to look at physical health and mental health in their entirety, not separately.
Some have called for universal health care for people with mental illness. Would you support something like that?
Well, I support universal health care for everybody, not just those with mental illness, because I think it's so critical. There's a real connection between one's mental state and one's physical state, and we can no longer bifurcate them. I think it's important to look at them in its entirety, and universal coverage is critical to get that started.
Nicholas Ballasy, CNSnews.com, Washington.